Black Brothers View, Black Brothers View, BBVTV, Black Brothers View. I am your host, DL Gitron. Welcome to Black Brothers View TV, right here on YouTube. Listen, we come to you every Friday night live. This is the place where the Black brothers' perspective is respected, where transformation takes place through conversation. This is the place where his voice, your voice, my brother, is valued and it matters. And so we're glad to have you here tonight. We got real good night tonight as we talk about men's health. So our theme tonight is Barbershop Talk with the Doc. Barbershop Talk with the Doc. And in the barbershop, we talk about everything. Sometimes I just sit in the barbershop and I just laugh and I take out my phone these days because there's a lot goes on in the barbershop. So Barbershop Talk with the Doc. This is a segment we're going to be bringing to you often just to make sure that we focus on the whole body, the wholeness of the Black man. And so we have a special guest with us tonight as we do that. But before we do that, I would like to bring to you a familiar BBV TV guest who is, of course, now one of the voices of BBV TV, who will be serving as my co-host for tonight. Give it up for none other than my frat brother, Leon DeBerry. Come on in, man. Come on in. Glad to have you here.
Hey, how you doing tonight?
I'm good, man. How you doing?
Oh, I'm doing well, doing well.
Glad to have you co-hosting with me tonight, man. Helping me handle this tonight.
Yes, sir. It's a pleasure. It's a pleasure.
And be a part of this dialogue as we focus on, and the verse for tonight comes from 3 John, the first chapter and the second verse. And that's something God's even given me for this year. And it is, beloved brothers, I speak that you be prosperous and in good health, even as your soul prosper. And so as we talk about being in good health tonight, that's appropriate for talking about men's health tonight.
Mm-hmm.
You ready to get into the conversation tonight, man?
Ready.
All right. So right now, our guest expert tonight, as we talk with the doc, we're gonna bring him to the mic and allow him to introduce himself. If everybody will give it up for none other than, and by the way, Leon is frat, if y'all didn't know. So there's a lot of black and old gold stuff going on here tonight.
Oh,
so,
yes.
If y'all feel ice cold, you understand why.
No doubt.
Yeah. And so Ice Cold brother is about to come up now as our guest expert. Give it up for none other than Eric K. Taylor. Come on up, man.
What's up, frat? Good evening, brothers.
Hey, frat 06, man. What's
06, brothers. 06. Yes, sir.
Listen, man, it is an honor. It's a privilege to have you as our guest tonight. And I declare that this is going to be the most watched episode broadcast just because you're here tonight and talking about men's health. Now,
all right.
Before we go into that, I would like for you to first of all introduce yourself to everyone.
All right. First of all, good brother Gitron, brother Peterson, brother Leon, my frat, coldest brothers on this side of heaven. Goodwill is the monarch of this house, my brothers. I appreciate y'all for the invite, and I thank y'all for what y'all are doing in the community here to share this message across your platform. I'm Eric Taylor. I am a men's health nurse practitioner here in Houston, Texas, and I have been in the game 22 years here. My passion has always been men's health, and I am the CEO of Priority Male LLC, where men's health is the priority, where I focus on educating men on preventive ways and proactive ways to keep their health in check. I'm here to motivate you, educate you, and help you navigate your individual wellness journey. and I want to leave this place better than I found.
Man, that's awesome. That's awesome. That's awesome. You said 22 years.
22 years in the game, brother.
Wow, awesome, awesome, awesome. You know what? And before going any further, I am the black man that I am in the earth tonight and today, because my black mother was born on today, and she's celebrating her birthday today, 70 years.
Happy
So I want
birthday,
to salute
brother.
and dedicate this out to my mom. Happy birthday, Mom. I love you so much.
Yes, sir.
So listen, before we start every broadcast, we always have what we call an icebreaker. And so did something last week, and I'm like, we didn't get, it was good, but I wanted to go back to it again because I love the way it was rolling. And so it's I love, I hate from A to Z. Things I love and I hate from A to Z. And the way it goes is you have to name something with each letter of the alphabet and see how far down the alphabet you can get without pausing, without getting stumped, okay? Without pausing longer than 3 seconds. So for instance, I love apples. I hate aggravation. I love balloons. I hate bats. You got it? Eric, you got it?
Got you, brother. Got you.
Okay, so see how far we go. So we're gonna bring our producer on so he can be a part of this as well. And I'm gonna participate tonight as well. So
Okay.
we're gonna roll it around and see how far we go. And so since Leon DeBerry had a jump, we're gonna let him go first since he did this last week and see how far he can get today. And then after Leon, then we're gonna have Peterson, and then we wanna have you, and then I'm gonna see what I can do. All right.
Okay.
So from A to Z, I love, I hate. Leon, ready and go.
I love apples. I hate aggravation. I love bears. I hate bananas. I love cactuses. I hate cats. I love dogs. I hate dandelions. I love elephants. I hate eagles. I love, oh man.
All right. All right. There you go. Hey, there's some brain work here. And I said I was gonna add to it a timer later, right? But I didn't even need to do that tonight. Well, Leah, how far you got? That was what? What letter?
Well, I was about to get to F, but I didn't quite get there. I got through E.
You got the E. Okay. E. All right. So Mark, go. I love and I hate from A to Z. Go, Mark.
All right. I love alpha.
All right.
I hate allergies. I love babies. I hate bears. I love cars. I hate candy. I love dogs. I hate dinosaurs. I love elephants. I hate eggs. I love females. I hate fried foods. I love God. I hate greedy people. I love heaven. I hate hell. I love ice cold things. I hate ignorant people. I love jump offs. I hate jerks. I love kings. I hate kangaroos. I love my wife, Lorinda. I hate losers. I love Mark. I hate Maybachs. I love Nancy Wilson. I hate neophytes.
Brother.
Oh,
man.
See, that's it. Bro. So at the end.
Wow.
Listen, y'all. I want to put this out there. This is just a game.
Wow.
They're just trying to throw out a word to stay in the game. This may not really be this how they feel about this. Okay.
No,
We got to put that disclaimer out there. All right. All right. So come on, our guest tonight. Come on, man.
Man, you gonna have me come up at the Brother Peterson? Brother Peterson killed that thing, man. He
You know what?
assassinated.
For a minute, I thought he was reading something, right? I thought he done wrote this thing down because he was
Oh,
flowing with it.
man.
From A to
All right.
Z, I love and hate. Ready and go.
All right, I love Asian food. I hate attitudes. I love breasts. I hate bologna. I love celery. I hate chicken. I love my dog. I hate. Ooh. Man, that ain't as easy as it seems, bro.
Exactly. Exactly. And you know what? I almost
Whoa.
want to move on now because Peterson got me nervous.
I see you trying to get it out.
Peterson got me nervous. Well, listen, I'm gonna go ahead. I'm trying. Okay, so love and hate from A to Z. Ready, and I love alphas. I hate aggravation. I love balloons. I hate bats. I love celery. I hate cake. I love dogs. I hate drama. I love elevation. I hate eliminations. I love fruit. I hate phoniness. I love God. I hate greedy people too. I love humility. I hate havoc. I love intelligence. I hate isolation. I love joy. I hate jealousy. I love kindness. I hate. Oh, I can't say kindergarten. Oh my God.
Brother.
No,
That
listen.
was a good one, brother. I like
Listen.
that.
I was.
I should have said kangaroo too. Listen, only thing came to my mind was kindergarten, and I was not gonna put kindergarten out there.
Hey, it didn't mean that you really hated it.
Mm-mm.
You was
Right.
just, you was
And
just
somebody
continuing
get this
on in
little
your
clip.
journey.
Somebody get this clip later and be like, watch it, watch what he say. I hate kindergarten. That's all they got.
Yeah, that's true.
Yeah, but hey man, all in fun. I appreciate y'all with that with the
Oh, yeah.
icebreaker, man.
That's a good one, brother.
Listen, appreciate it, man. Listen, so tonight we're talking about mental health. Why you're not really it's officially a doctor or whatever. Many times a nurse practitioner have to step in the role of a doctor and for a doctor all the time, and actually has a tendency to make. I mean, where would a doctor be without the nurse practitioner? I've seen it firsthand. On many occasions, and so. This segment is just called, Barbershop Talk with the Doc, and tonight we're going to be focusing on three main questions or three main concerns regarding Black male health. Now, in addition to that, we want to ask any viewer out there to please text any questions that you may have of the doc tonight, our medical profession for tonight, and he will do his best to answer those questions. Our producer will let us know when you put them out there. Don't be shy about it. It may not be about you directly. It may be something you feel that just men need to talk about. And so please make sure that you put it in the comment box tonight. One of the things about men is that a lot of men, Black men, fail to go to the doctors like we should. We treat our cars and our careers, sometimes we give it more attention than we even do our own body. And for some reason, it seems to be this macho kind of thing. I got it, I can take it, I can handle it, aching and in pain and all kind of things going on, even, I've seen some brothers technically who just need pedicure, I'm like, man, you see your toes? Man, come on, it ain't supposed to be, I'm a man. No, man. Your toes not meant to look like that, And so with all of this care and everything that we have out here, some men are not doing everything we can. And guess what? If we don't take care of ourselves, externally and internally, we're not going to be good for everybody who's dependent on us. So I'm glad to have these 3 questions that we're going to focus on tonight. And then, of course, anything else that may derive from that. In addition to that, before we end tonight, we have 5 hot words for the doc. 5 hot words. We don't even know what these 5 hot words are, but we surveyed and we got these 5 hot words, and he's going to tell us the first thing that comes to him, it comes to his mind regarding men's health and that word. All right, so we'll get to that in a minute. But right now, I'm gonna ask my co-host if he would share with us the questions for tonight that the doc is going to give us some feedback on and some information on.
All right, Brother Taylor, I'm thinking about the first question here.
All right.
When we think about what are our appropriate health screenings based on our family history?
Okay. First of all, I want to give a shout out to all of our physician leaders in the community. As a nurse practitioner, we help extend their reach and reach more people in the community. And again, we couldn't do what we do without them. And we are working together collectively to meet the needs of the community. That's a great first question, brother. And you got to know your health history. One thing that I find with us as a people, we miss a great opportunity to talk about our family history. And you know what that opportunity is? It's our family reunions. Think about it.
Right.
COVID-19 has changed what's going to happen for family reunions this year. But outside of that, normally we're in family reunion season right now. We're getting together, barbecuing, chatting it up, and catching up from good old times. And most of us are looking for shade and lemonade when we need to be sitting with our loved ones and figuring out what their health history is. If someone in the family has told you that you look like a particular individual and you see them and you be like, yeah, I do look like a younger version of them. If they are still alive and you see them at the family reunion, it would be nice to sit down and talk to them about their health if they're open about it and see what they're willing to share, because what demonstrates in them is likely going to demonstrate in you, because you are fruit from that tree. And if you look like them, you're from the same genetic pool of makeup, guess what? You're going to have some of the similar health conditions that they have. And knowing that can help you be a little bit more proactive and maybe find a way to be a little bit more preventive when it comes to trying to keep those conditions that they have from happening to you, or know what to look for if they were developed. So for most men, our age-appropriate screenings don't start until we get into that 4th decade of life at age 40. And at age 40, if you have a family history of prostate cancer, and you know that, you need to articulate that to your doctor. And you, unfortunately, because the guidelines have changed, you're going to need to advocate for that screening if there is a family history. After that, age 40, that's really it for age 40. Outside of that, blood pressure on an annual basis, checking your cholesterol at least every 5 years, screening you for diabetes if you have diabetes in your family. And again, depending on the risk factors, you may screen frequently for that. And then having your routine annual physical, just going in and let your doctor kick the tires, check the oil, look under the hood. At age 50, colorectal cancer starts. And again, colorectal cancer is one of the most preventable cancers we have out there, but most of us don't show up to get it done. And unfortunately, a lot of us in the African-American community are dying from colorectal cancer, you know. And then you screen for colorectal cancer and prostate cancer on until age 70. Actually 75 for colorectal cancer, and you stop at 70 for prostate cancer. Depending on your risk factors for lung cancer, you may get that screening starting in your 50s as well. And again, a lot of times we think this beautiful brown, black skin and the many different shades that we come in, we think it protects us from skin cancer. We're not immune, brothers. If you are more fair complected, and even if you are darker, you still should have your skin assessed to make sure there are no abnormalities for skin cancer. And that should be an annual assessment after about age 50. And it kind of, again, depends on what your history is with that. But again, knowing your family history, knowing who has what, is going to be some triggers that are going to help guide you so that you can make sure those things are being checked in your body as you go see your doctor on a regular basis.
Wow. Wow.
That's very wise advice. You know,
Yeah,
a lot of us go back and forth every year to family reunions, but we don't think to ask those questions.
we don't. We
Right.
miss that opportunity. We miss
Right.
it. And
Yeah.
that's the perfect time, because think about it. You got multiple generations together. People are in good spirits and y'all are catching up. And that's the best time to have some type of health discussion with the family, especially
Right.
to help the younger generation live a happier, healthier, longer life. But we don't talk about it.
Yeah.
Well, when you made mention about somebody looking like somebody, I thought, I thought you was about to say that might really be your daddy over there.
No, I wasn't thinking that. I mean, hey, there's a potential for that, but in my mind is the genetic predisposition. So let's say,
Right.
they say you look like Uncle so and so,
Right.
and you look at him and you be like, yeah, I do look like him. You are a part of that gene pool. All of those genes started somewhere and you became a fruit on that tree at some point in time. But if you look like them and they are still alive, chances are what they have, you could potentially have. And just having that conversation with them, if they're open and willing to share, could help save your life.
Yeah, that's good. That's good. That's good. Women talk all the time.
Oh, bro. Woo. Yes,
But
sir.
I heard you said on one of yours on Power to Mail that men fail to speak about things below the waist, that's concerned us. Women, I mean, I've seen women touching each other's breasts to see whether they, was any lumps there or whatever, just checking each other out, touching, talking to each other about very intimate things. And you think about it, guys don't talk about stuff like that, You may hear a guy say, hey, you better go get checked, man, you better go get it done, and that's it.
That's it, bruh. Women, get women over mimosas and brunch, and they're gonna talk about everything, and they're gonna talk about men as well while they share their health struggles and challenges. Us brothers, we're not gonna talk about that kind of stuff. That's why we live shorter, sicker lives, and we suffer in silence. Okay, we don't talk about. We know we don't talk about stuff below the belt, but we don't talk about our health in general. We'll talk about everything but that. We'll talk around the subject. We'll talk about cars, guns, how many women out there, what's going on in the streets, what's popping over here, what's jumping over there, and we will ignore the elephant in the room. Your boy Willie, you see him, you know he ain't well, but you ain't gonna say nothing. You ain't gonna say nothing until you get the call from Renee that Willie done passed, and then y'all at the funeral, then you want to pull out some for Willie later on because your boy passed on, but no one had the conversation with Willie. No one checked on Willie. No one asked Willie, was he all right? Because we don't know how to do that. We don't know how to be vulnerable. And a lot of that has to do with how we are raised here in this country. Men are fixers, we're providers, we're protectors, we're priests in our homes and things of that nature. We wear all those hats and we take care of everybody else, and we take care of all the mechanical stuff that's going on in the house with our car. We take better care of them 2 or 4 wheels that we ride on than these 2 arms and these 2 legs. And I know I'm right, because most brothers will spend more time investigating something they want to buy than they will investigating their health.
Right.
And
that's why we have this platform right here, man, so that we can just talk about any and everything from A to Z that we need to be mindful of, so that we can be transformed through communication, transformation through communication. What's up next, Leon?
Now, for instance, if you've had labs drawn prior to your appointment to the doctor, should we ask if our labs are normal or abnormal?
Yeah, okay, great question, brother. So, first of all, be fasting. Go get your labs fasting, because they're likely going to check your cholesterol and check you for diabetes. And you want to make sure that's an accurate reading. So now, one thing I want to plug here is that any labs you have done, those are your results. So when you go to the doctor, don't just have them tell you about it. Print out a copy so you can keep your own record, just in case you don't go back to that doctor. You got this record that you can share with your next doctor. So if I do my labs, I need to know, hey, doc, what are my risk factors? What's high? What's low? What are we concerned about? Do I have diabetes? How's my cholesterol? How do my kidneys look? How is my liver function? Did you check my prostate? If you did, where are we? And then if you've been seeing that doctor on a regular basis, how does this compare to my last labs? Have we made progress, or are we getting better, or is it getting worse? And from that, am I at risk for some conditions, doc? And if so, do I need medication? And I think we may get into that at some point in time. But also leave there leave there with a copy of those labs, man, because you may have someone else in the family medically inclined. You may even want to reach out to Priority Mail for a consult about the labs because you didn't feel like they really explained it to you. Because I'm going to be honest with you, brothers. In the healthcare arena, we get so busy, we get so focused on the numbers and trying to see the next patient and the next patient and the next patient because we're trying to make that money. We don't spend the time we need to thoroughly explain to the patients why we ordered what we ordered and what that means to them for their health. So you may get a very generic explanation that may not be fitting to you, and you'll leave there still with more questions and concerns. Like, man, he told me, but I really still don't understand. Get them labs, get away from there. If you go back, that's cool. But if you don't go back, your next doctor, when you show up, you take those labs and, hey, doc, I had these done at my last doctor. What do you think? What do you want to order? And if you have questions, Priority Mail is always here to answer those questions to help you have a better understanding of it, you know, how this impacts your health overall.
Right. You know, listening to you, it's very important. I'm thankful that I have doctors that take the time with me. They sit down, you know, and one of my doctors even, he would draw little sketches and stuff, trying to paint the picture for me, help me to give me a visualization.
Some people are visual, exactly.
Right, you know, and that if they move office, guess what I'm doing? I'm moving too. Right, you know, and this has happened a couple of times, and so it's very important. Now, I've had to leave doctors alone before because they didn't give me that kind of bed manners that I felt I needed. And I know you're making this money off me, and this is my life and my health. I think it's very important to make sure that you are connected to a doctor who gives you that time, who gives you that good balance with, hey, I'm trying to go and make this money and see other people, but at the same time, I'm trying to make sure that you know that you're important to me right now, that I get all your concerns. So I had to throw that out there, man. That's really important, and I appreciate the doctors that I have, and I just admonish all guys to make sure that your doctor takes the time with you. And if you got a doctor that's rushing, I say find another doctor.
Go see somebody else, brother. Go see somebody. And that's a great point, Brother Gidron. And I would say here at Priority Mail, I'm trying to leave this place better than I found it. Now, let's be honest, this is a business and I do have bills that I need to pay, but I'm only seeing a small amount of patients because I want to be able to give that dedicated time to each individual. When you're there seeing me, I don't want you to feel like I'm distracted, have my mind somewhere else. I'm focused solely on you, what your problems are and what our plan is, and our shared decisions, what we're going to make for you that are going to help you move forward. Not everybody has the time or is going to take the time to do that. And I would say you have to make that connection with your doctor, have that rapport with your healthcare provider where you feel that they're listening and they understand you and they're making decisions with you, not just saying you need to do this, and not hearing what you have to say. I'm going to make a shared decision with you about the facts. And from there, we are going to build an individualized plan that works just for you. It's not cookie cutter over here. Now, we need medicine. Trust me, I'm going to tell you, hey, man, we can't do nothing about that unless we do this with medicine. But if you want to try diet, lifestyle modifications, and try to do all those things, I'm happy to follow you, see you more frequently, check your progress, and let you see where you are with the things that we're trying before we add medicine. I'm not one to just start lobbing medicines your way, because at the end of the day, I throw all these medicine at you and you have to just address the underlying problem. Guess what? You just got 10, 12 pills you're taking and you still got the same problem. So I want to take that time, get that individualized approach with you from a holistic standpoint, realistic standpoint as well, but also meeting your individual needs.
Man, you're remarkable with it. Even what you do at Priority Mail on Facebook and stuff, man. The way you take the time is like you're talking to your friend or your brother, and I mean, I just love the way. That's why I wanted you here today, because you break it down, you take the time, you explain it, you don't make nobody feel like that's a bad question, it's good, man. I love the way you're gifted to bring it the way you do. You're not just skilled at what you do, but you're gifted to deliver it the right way.
I appreciate that, brother. I think I told you earlier, I'm not perfect. So I always try to share with the men. I'm down to earth. I got the same issues you got. I live the same life you live. I'm a black man in this world with all the same challenges. And I'm not perfect, but I'm perfect for what I'm doing. And I know that this is what I'm supposed to be doing because I can do it so easily. And from the feedback Brother Gidron has shared, and I hear from a lot of patients and other colleagues, I know this is what I'm supposed to be doing. So I don't take this lightly. And I want to make sure that I leave this place better than I found it. And I want to share the knowledge and the information that I have with those that'll sit and listen. When you think about your doctor, you need to have, it should be a partnership. When you come to see me, yes, I'm the healthcare provider. Yes, I have the knowledge, but you're my patient, and we're going to partner in what is your problem and how we can fix it together with the science and the evidence, along with what are your priorities. Because once we identify your priorities, then we can have science work with that and not against it. And a lot of times the doctors are talking at you and not listening to you. And that's not what I do here. I want to listen to you. Then we have a conversation together that's going to work.
Right.
Sure.
Yeah.
And, you know,
Awesome.
based on the appointment, once you go and talk to your doctor about your lab results and whatnot, if medications are prescribed for it, do we need to go further into talking about alternative therapies, about generic or non-generic, side effects, precautions, all those things that happen with taking medication?
Great question, Brother Leon. Great question. So what I would say before we get into that is make sure you tell your doctor all that you're taking, okay? Because a lot of times, you know, we're taking things over the counter. We're taking herbs. We're taking some we ordered off of Amazon, some we saw on some infomercial, or something our homeboy told us about at the corner store to pick up, this, that, and the other. Come on, let's be real. I hear it all. Make sure, first of all, you have come clean on everything you've taken, because although you may not consider that medicine because you can get it without a prescription, it may interact with some of the stuff that we may prescribe you that you actually need. And we didn't know, and we're not here to hurt you or harm you. But if you didn't tell me and I wrote you so-and-so and found out later on that it interacted with that horny goat thing you picked up at the corner store, and now you in the ER with chest pain, you didn't tell me. So first of all, be full disclosure with everything you're taking over the counter and herbals and all of that. Secondly, once your doctor starts to say we need medication, this, that, and the other, make sure you understand what the medication is for. Are there any side effects? Is there anything I need to be on the lookout for? Will this affect my kidney? Will this affect my liver? Will this affect my GI system? How long will I be taking this? Will I take this for the rest of my life? Is this temporary? And then, are there any alternatives? Can we do a trial of diet, lifestyle modification where I'm going to try to eat better, I'm going to exercise, I'm going to intentionally try to lose weight, and I'm going to do those things before I get on the medication? Because guys, I'm going to be honest with you. If we keep our health in check and we focus on keeping our weight in check and eating better, exercising, and hydrating well, a lot of the conditions that you have, you can really keep them at bay for a long time. And a lot of it is just us starting in the kitchen, man. And it is not the gym the first place. The gym is not the first place we need to go. The first place we need to fix this is either in our kitchen or stop going through these franchise feeding troughs that are all scattered around us, the Golden Arches and Carl Jr. and Chick-fil-A and all of them. I ain't knocking them because, look, I won't be real with you. I like them myself. But if that's where you go get your nourishment every day, the food, this processed food is slowly killing you and rapidly giving you diabetes, high blood pressure, high cholesterol, colon cancer, and all that other stuff, man. Because this processed food, man, it's not good for us. It's really not good for us long term. So start with your diet, get moving, try to lose some weight, and keep everything else in moderation. Again, if you like to have a drink every now and then, you like to smoke a cigar every now and then, I'm raising my hand because that's what I like to do. And everything in moderation, you know. We're not going to cheat death, but sometimes we expedite death by what we do or what we don't do, or if we do too much or not enough of a certain thing. So the key is about balance, brother, moderation and balance. And so now if you happen to need to be on a medication, this is what I want to tell you from a cost-conscious standpoint. If your doctor is writing a brand name, so let's say, for instance, he wrote you a medication for pain or for erectile dysfunction, something new. You go to the pharmacy and you find out that this medication is $300. You need to immediately have them call your doctor and tell them you need a generic form of this or another option. And for me, I always think about my patients that are underinsured or uninsured at all. When they're coming to see me, if they have to pay that copay, it makes no sense for me to take that copay and then write them a prescription for something they can't afford. Are you going to get the medicine? Hell, you're not going to take the medicine.
Wow.
You just
Right.
gave me your last to see me. And then what kind of person am I to write you a prescription for a medication you can't even afford? So I'm intentional with prescribing from the $4 or the $3 program. There are several programs out there with CVS, Walgreens, and Walmart. And if you tell your doctors, doc, please prescribe from the Walgreens medication plan or the CVS plan or the Walmart plan, wherever you shop, they all have a plan. And that plan is typically $5 or less. And if you tell your doctor to give me a medicine from that, it is a generic medicine, which means that it has all of the same components as the brand medicine, but the brand label or patent on that medication has run out. So these other companies can't produce it. And brand generic medicines, unless you have some kind of rare genetic issue where you have to take certain brands, you can take generics and be just fine. Okay. And that saves you money while getting you the medication you need to manage your condition.
Right. You know, and as I was listening to you, I was hearing my doctor talk to me, you know, because we've been dealing with my weight, you know, my weight gain and everything. I'm, you know, trying to lose some weight in a healthy way. And I have to always say that because people losing weight in a way is not in a healthy way. I walk every day, you know, and I'm doing some other things, trying to make sure that he eventually placed me on pressure medicine because my pressure was like up and down, being escalated and at different times. And he would watch it, you know, not being quick to put me on medicine. You know, he would say, okay, we'll watch this for like 3 months. And then when you come back, you know, we'll see where we go from there. And he knew I wasn't anxious just to be taking medicine anyway, but I also saw that he wasn't, you know, that wasn't his first go-to, you know. He was always trying to get me to, and then he said the same word you say, partner with him, you know, and he would try to advise me and like, okay, this is what we're gonna do, you know. So and even with the cholesterol thing, you know, because one of the things he made mention of is like, he said, well, there's a couple of things with cholesterol you can't fight. He said, one, because of your race. You know, he said the other thing is your age. And you know, as you get older, you have to deal with that. And I forget the third thing.
Genetics, maybe possibly genetics.
Yeah. It was genetics, right.
Yeah.
It was genetics. And so these are things that you cannot, you know, and so sometimes you eat the best you can, and sometimes you still find yourself having to do something else, maybe some supplements or something that you have to do differently just to try to make sure and get that under control. So all these are things that I wouldn't know, I wouldn't be aware of about myself if I wasn't having a conversation with my doctor and if I wasn't having lab work done, you know? And I just admonish brothers, man, to get these things done. I'm gonna ask, now I'm putting the question out there to my co-host and Peterson. Putting you on the spot. I know, please don't holler later. When last time y'all been to the doctor?
That's a good question, brother. I am scheduled. My birthday is on the 19th of this month, and I am scheduled for, I think it's the 14th. So I'll do my annual physical. I try to do it around my birthday, so I have no excuse as to why I didn't go and all that. So I'll be going in a couple of days. And I'm probably going to share it on my platform because I like to say, I want brothers to see that as a healthcare provider, I go to the doctor too because I got the same problems as you. I'm in my 40s, about to turn 43. I've had my date with the finger. I've had all of that, brother. So again, I'm not immune. I don't put on this stethoscope and hide behind these titles and not have to go get the same stuff you have to get done. Speaking to you, I'm not only speaking to you from my experience clinically and what I see every day in my profession, but I'm speaking on my personal stuff. And if you're in the Priority Male group, if you haven't, you need to join. Brother Gidron can speak to that. I speak about that all the time. I always try to make it tried, true, and transparent because I want you to relate. I don't want you to think I'm just speaking to you. A lot of times I'm speaking for myself as well because I've experienced it, brother.
Oh, I mean, it's real. You come real. I mean, every brother needs to be connected to that. Leon, when last time you been to the doctor?
he's muted, but while he's getting back on, I actually had my physical about 2 weeks ago.
Good deal, brother.
Yeah.
Good deal.
Make sure I go every year. So
Okay.
yeah, I go.
Okay.
That's good.
That's
good.
Yeah.
And most brothers don't. Man, I see patients on a regular basis that'll tell me, and they'll say it with pride. Man, I ain't been to the doctor since my son was born. And my first question to them is, how old is your son? Oh, my son, he's 22. He's finna graduate college. I'm saying, so you telling me you ain't been to the doctor in 22 years? Well, you know, I've been off and on. I go for a little cold, a little, you know, this and that, but I don't go on a regular basis. I don't need to. I'm healthy. But then they can't go up a flight of stairs without almost passing out. That's a problem. But again,
You don't
we
know.
do that
Yeah.
with pride.
Yeah, you don't know nothing about the inside, the condition of the inside of your body. You cannot see in there. You don't know anything of what's going on in there. You're waiting to feel something, and all the times you won't feel something.
Yep.
You know, things could be going on and you're not going to feel it.
Like blood pressure. Blood pressure is a silent killer. And
Right.
you don't necessarily have, when you start having symptoms from blood pressure, my brother, it is far too late because your heart has enlarged, your kidneys are probably shot, and there's not much they're going to be able to do. They're probably going to put you on 4 blood pressure medicines at one time and try to save your life if you don't need dialysis, because it is over from there. Because once you start having symptoms from blood pressure, your body has been compensating for many years.
Yeah,
and
yeah.
we can do
Yeah,
something
and-
about it.
Right, yeah. I have a history of brain tumor, angiofibroma brain tumor, and I have a
Wow.
history of a stroke, history of I've had blood vessels to pop inside my head, you know, aneurysms, and so you know I've had to walk and talk all over again, everything. So these different things that I've had to endure, and always hearing from the doctors have made me conscious about being proactive about my health. And when I see myself getting to a certain place or feeling a certain way, you know how, and my mom would always say, you know, you listen to your body will talk to you.
Yes, sir.
You know, your body lets you know you need rest. Your body, you feel some kind of way, fatigue, this way, whatever. You know when you're not feeling right, and
Yes,
you'll
sir.
just go past it. A lot of times guys fight past that and keep on going and stuff, man, you know, and we got to pay attention to it, and we got to stop, quote unquote, trying to provide so much for the family that we are no longer around for the family.
Bro, you just said a mouthful, brother, and I would echo that, brother. And again, salute to you, brother, for, you know, still sharing your testimony and for the things that you've been through and to still be here trying to do the right thing, brother. I salute you for that, brother, and sharing that, because some men need to hear that. And Almighty God is shining down on you, man, and you are supposed to be here for a reason. So don't take that lightly. Do what you need to do, be there for your family. But man, we need to be more proactive about our health than we are reactive. And we typically react when it comes to our health. We don't take the preventive measures like the preventive maintenance we do on our vehicle. We wait until something happens, and then we want to patch that without addressing the underlying problem. And then we end up with conditions that, had we done more for it, we could have prevented it or stabilized it and still lived a good quality of life. But because of the way we like to do it, and we want to go to Dr. Google first. So we got a lot of brothers out there, I call them Googleologists. And first, as soon as they start having symptoms, guess what they're doing? Google, what are these symptoms? And then they looking at the symptoms, and then they're trying to figure out how can they manage that without going to the doctor. Hey, the doctor is there for a reason. And you need to get those symptoms assessed with a true medical professional so that you know really what you're dealing with. Because Dr. Google, although it's a good start, for me, Dr. Google is a conversation starter with my patient. And I encourage patients. They come in the office on the phone. Hey, doc, I was Googling these symptoms. What do you think about this? I'm like, cool. Let's have a conversation. That's my time to educate and provide you with the evidence so you can know that Google starts the conversation, but Google is not the end all of that conversation, because Google can be dangerous. So diagnosing yourself based on Google, you could expedite some things that could be unpleasant in your life. And I would encourage you not to do that on a regular basis. It's okay to check, but go get it checked. Be a man, go get a check. Be seen, get screened, brothers.
Right. Just use Google as an opportunity to be informed when you go to the doctor.
Yep.
So therefore, you have got when the doctor is talking to you, it wouldn't be your first time hearing it. You know, not just isolate that as all the information that you need. Man, listen here, you good, man. You good. There's some good conversation and stuff. But the thing about it is that we're gonna have to definitely have you back because there's so many different. Like I said, I love this barbershop talk with the doc. You know, and let me tell you, you know, and when I say doc, just so people, you know, and I'm speaking from the medical aspect or whatever, because whether that's coming through a nurse practitioner, a pharmacy or whatever, you know, to me that falls under the doc, you know.
It's all good, bro.
You connected with the doctor, all right?
Yes,
and the information is coming and it's good for us and we need it. So we're definitely gonna have a continuation of this. And I want to encourage all before, well, we're going to do that in a minute. Right now, like I said, we definitely going to keep having you back, man, because this is, as I'm listening to you, I hear my doctor talking, you know, but I also want to say to brothers, all you brothers out there, first of all, if you have any questions, put the questions there, you know, even if you watch it later, put the question there and we'll make sure and get it to, you know, to them so we can give you some answers. But I want to say to all the brothers out there, listen, you are valuable. You are a king. You are a priest. You are a chosen generation. You are a precious treasure. And if nobody else have told you this, when God created you, he created you in his image and after his likeness. He saw some good in you. He has some good for your life. You are a purpose vessel. And so when everybody else seems to be tearing you down, God is constantly trying to build you up to still do what he's called for you to do. So see yourself as royalty so much that you take care of your royal self, you know?
Amen.
And if nobody else is doing, you don't need no spouse, no mate. You don't need nobody to tell you to take care of you because you can't do nothing for nobody if you don't take care of your royalness. You are royal, my brother. Yeah. So take care of yourself. All right. So we got 5 hot words. 5 hot words. You don't even know what the words are.
All right.
I'm gonna give you the 5. Done a survey, got the 5 hot words. I'm gonna give you the 5 hot words. As soon as I give you the word, we're not gonna spend a long time on it. Tell me your first thing that come to your mind regarding men's health. Okay. All right.
It's gonna be interesting, brother.
So the first word is suicide.
Suicide. Wow, man. Okay, so we do not talk about mental health in our community. A lot of us, again, have an underlying mental health disorder, and we chalk it up to, oh, he just got a touch of the nerves, or he just a little anxious, and we do nothing about it. And we see them self-medicating all the time. Right now, somewhere, somebody's getting their prescription filled at the nearest ABC store or a liquor store or a street pharmacist to manage their symptoms when they need to be seeing a medical professional and get a very thorough workup and get a true diagnosis with appropriate therapy. And when we understand mental health disease, it doesn't always mean you need medication, but suicide in our community is becoming a thing, and more people of color are killing themselves than we ever could have imagined. And so we gotta have the open dialogue about it and be willing to be vulnerable and acknowledge that we have a problem and go get help. But in our community, we don't like to address mental health issues. We'll do more about health than we will mental health. And you can't complete the person if you haven't addressed the mental health along with the physical health and the spiritual health well-being. So that's what
Awesome. And Martin, the audio seemed to be a little distorted. I don't know if I just want to bring that to your attention. And speaking about that, before moving on to number 2, there were a couple of times in my life, and I'll talk about this more instant later, that I contemplated suicide. I was heavy. I was weighted down. I was tired. I wanted it to stop. It wasn't that I lost faith in God. I just didn't want to deal with it no more. But because of my faith in God is why I kept going, you know. And so,
You need to share that, man. You need to hear that because we don't talk about it.
oh yeah. I mean, I've dealt with nervous breakdown and the depression, and a lot of times people see you strong with your faith, or they see you strong as a man and whatever. They don't realize, you know, like Paul would talk about in the Word of God. You know, he felt like an ambassador in chains. You know, like you around a lot of people and you encourage a lot of people, but people don't understand what you're dealing with, nor do they seem to really care. And so you're weighted down with that, and a lot of times you want to be done with it, you know. And so it's good when you got somebody. I'm glad that David had a Jonathan, you know. So anyway, moving on. We got to revisit that. I'm still, can you hear me clear?
Yeah, I can hear you, brother. You good.
Okay. So number 2, the word is masturbation.
All right. So I talked about this. I did a live feed in the Priority Mail group. Maybe, I think it was last weekend. And I talked about this, and so what I was saying about masturbation, it is completely normal. When you think about the psychologists and psychiatrists out there that we use to study their theories and understand the development of the mind and sexual health, masturbation is completely normal. Now, the Bible is not as direct when it comes to what that is. And so for my biblical scholars, my believers who I am as well, and pretty much in the Bible, it talks about the man being defiled. It doesn't necessarily call out masturbation as a sin, but it says that the man will be defiled. When it says that, it lumps a lot of things in that definition. But from a human standpoint, pleasuring yourself is probably the safest sex you're gonna ever have, my brothers, especially if you know what I know about what's happening out here in these streets. But there's nothing abnormal about it. Now it becomes abnormal when it affects your personal relationships, when it affects your job, your interaction with others, and when you may do what we consider lewd acts in places that you wouldn't do it. Most people, if they're gonna do it, they're doing it in the privacy of their own homes. And a lot of times, some relationships and couples, they use that as a part of the love making. So it is completely normal. So don't let nobody tell you that it's abnormal. And all the myths
I can't hear you. Can you hear me? Can you hear me? Mark, do you hear what I'm hearing? I want to make sure that everything you're saying is going forth. Mark, can you hear what I'm hearing?
I can hear you get around, brother Taylor. Your sound is low. Maybe your speakerphone went off, but your sound is low.
Yeah, because I can hear you good and clear, Mark.
It's low.
It's distorted. It's low.
Very low.
Yeah, it's real.
Did it change any?
Yes, there we go. There we go.
You better? Okay, my bad. I'm not sure what happened, brothers, but so you need me to revisit that question, brother?
Yeah, if you can briefly. All I know, the devil is a liar. We got you back now, Caroline. All right.
All right. So with regards to masturbation, brothers, what I was saying was it is completely normal. There are a lot of psychologists and theorists that we have studied in medicine that point this out, that it is completely normal. There's nothing abnormal with masturbation. It becomes abnormal when it affects personal relationships, when it becomes a lewd act, and when it affects your ability to maintain the social interaction with the public, or you're keeping a job. Outside of that, man, people do it all the time. They self-pleasure themselves all the time. And a lot of couples and relationships use it as part of the love-making act. Now, there are a lot of rumors out there about it's going to make hair grow in your hands. You see any hair in my hands? No. It says it's going to make you lose your sight. I see you and hear you, and I'm talking to you. But so let's be real. As long as you're doing it in the privacy of your home, you're not, offending anyone, it is completely normal. And the Bible does not specifically say that it is a sin, but the Bible says that bed is defiled. But when the Bible defines what defile means, it lumps a lot of things together that are not acts that may be considered pleasing to God. But still, at the end of the day, from a psychiatry standpoint, this is a normal part of development. Some people grow out of it. Some people touch themselves more frequently than others, but it is completely normal.
Okay. 'Cause I know I heard somewhere along the line in years and way back before even the doctors that you got the headaches because you need a release and all kind of stuff,
That decompression.
Okay, all right, okay. So
So let me add one thing. Let me add one thing to that, brother. So think about it like this. There are dopamine receptors in your brain, which is the pleasure. There's a pleasure center in your brain. When you climax, whether it is from a sexual act or self-pleasure with masturbation, it releases those pleasure centers, which will help alleviate and decompress a lot of the stress or even headache that you have. So that's what's happening.
Okay. I got you. Number three.
Right.
I got either one of these can go on for a while, I guess. High blood pressure. You hit on it earlier a little bit. High blood pressure.
All right. So high blood pressure from a men's health standpoint, men fear high blood pressure because in their mind, high blood pressure is going to cause impotence. It's going to affect their love life. And that is so far from the truth. High blood pressure will put you at higher risk for heart attack, stroke, kidney disease, and eventually erectile dysfunction. But that's not an immediate cause with high blood pressure if it's caught early and managed appropriately. But unfortunately, in our community, that is the myth that's been sold for many years. And again, we out there telling half truths and whole lies about high blood pressure that don't even really exist. But if you get it managed, brothers, you can live a happy, healthy life, and your sex life will not be impacted by any means. But if you do nothing for high blood pressure, you can expect to die early and die young from either a heart attack, end-stage renal disease where you need dialysis and kidney failure, and possibly stroke on the brain. So you can do something about it, man, but we don't like to manage it.
Okay, so you was talking about sex and high blood pressure and all this stuff at the same time, and you made me think that if a person having sexual intercourse or whatever, and they're having high blood pressure or problems or concerns, that could be taboo, or that could be something for them to be concerned about.
Well, well, not necessarily, but I'll put it like this. If you're having erectile dysfunction, that's the first sign that something is wrong with your heart, your underlying cardiovascular health, okay? Because an erection is blood flow. Think about turning on the garden hose outside to water your grass or wash your truck or your car. When you turn that on, you expect that hose to get firm and water to come out the end, right? So when you get an erection, the firm piece of it, you expect blood to flow. But if you're having challenges with getting an erection, that means that the blood flow is somewhat clogged or slowed for a number of reasons. And a lot of times blood pressure is a cause, high cholesterol is a cause, being overweight is a cause, and then of course low testosterone at some point in time. But having high blood pressure, not getting it managed, and having sex on a regular basis, it does place stress on the heart. A lot of people don't see sex as an exercise, but it really is. It's a short-lived exercise, but it is. And if you have high blood pressure and you're not managing it, you could, yeah, let's be real. You could potentially have a heart attack in the act. And there are many men that have died in having sex. Many.
I heard about that, man.
Yes,
that's what
brother.
I was trying to move to. Are you serious?
Yes, sir. It's an exercise. Think about it. If you were to check your pulse during the heat of the moment, especially right before climax, your pulse is at an all-time high rate. Your heart is beating really, really, really hard. And a lot is happening in your body. And again, it is some stress on your cardiovascular system. It's stress on the body. Although it's enjoyable stress, it is stress. But if you have underlying conditions that have not been managed, yeah, you could potentially have some complications just from having sex, brother.
But just what you're saying as far as just the blood flow though, man, and everything related to your heart, the blood, the blood, and you just got to be mindful. This is why you got to just keep your body, everything that you do that you want to enjoy, you want to make sure that you got your blood flow in check, so that you can do whatever it is that you got to do, and that you need to do. And that's outside the house, inside the house, wherever, just so that you can function properly,
It needs to be a lifestyle.
Exactly. Okay, moving on. Number 4, I guess it deals with this a little bit too, STDs.
Woo! All right, brother. So I actually work I'm a director of nurses for the Center for Health Empowerment in Austin, which is a sexual health and wellness clinic that focuses on sexually transmitted disease in the community of Austin. Sexually transmitted disease, man. So let's be real. If you out there in the streets swinging and banging, doing whatever you're doing, smashing and dashing, pumping and dumping, whatever we calling it today, if you're out there doing that and you're not strapping up, not only are you at risk for sexually transmitted infections or sexually transmitted diseases, as we used to call it, or VD as it was called back in the day, you're at a high risk for HIV. And if you know what I know and see what I see on a regular basis, you can strap it up, because syphilis, gonorrhea, and chlamydia are on the rise, brothers, across the board. And the sad thing is, it ain't who you think it is.
Oh no.
The younger generation, the early teens, where they're kind of risque, so to speak. And sadly, guess who else is getting it? A lot of people that are in their late 60s and 70s, because grandma or pawpaw or whatever has gone through the change, and there's no chance of getting pregnant. And you will be amazed at what's happening at some of these nursing homes around the city that you live in.
Yes.
Look.
Yes.
There's some toe tipping and door knocking and bed rocking happening in some of these nursing homes, brother.
I know this.
And look, as far as my full-time job in law enforcement, man, I see a lot more people on my caseload.
All right.
Because of the blue pill.
Yes, sir.
My age group is usually 18 to 30. I'm seeing a lot more 65, 70-year-old men, because they got a hold of that blue pill.
Yes, sir.
Messing with young girls with drugs.
Yes, sir.
And then they get stopped with the drugs in the car. They get put on probation. So it's a full,
the game has changed
for wonders in more ways than one.
Yes, sir. The game has changed, brother. It is a different game out there. So you got to be careful. So with STDs again, brothers, you can't tell. You can't do a smell test. You can't do a whiff test. You can't. I want to be real. I want to be real, because I know how brothers do. I know how we think. You can't run your finger and say, "Oh, that no." You don't know, and that's the one that's gonna burn you. That's the one that's gonna get you, because you thinking you can look at it, you can smell it, or you can taste it, and you gonna know. You have no idea, brother. I wish you could be in the room with some of the conversations I've had with some men about this dime piece that they thought they was doing, the thing with, and what happened later. So no, trust no one, cover up until you know their results and they know your results, and y'all are in a monogamous relationship. No unprotected sex out there in the community. And also, if you didn't know, men, you can get gonorrhea and chlamydia of the throat.
Yes.
From oral sex. Yes. So if you didn't know, now you know.
I came across the gentleman while I was sitting in a hearing that was talking very raspy in his voice. And the hearing officer asked, "What's wrong?" He said, "I have venereal warts in my throat."
Wow. Yeah.
Are you serious?
Yes, sir, brother. Yes, you can get it, brother. You can get it. Trust me on that.
Wow. I mean, that you got to be careful, man. And and this thing about being young and do what I want to do, or the flip side of that, old and hey, I ain't got to worry about having no kids, or I'm past this, cause I've seen some older brothers, yo, what's up, Dad? And I work with senior citizens all the time, and I be seeing him. And I remember one time I had some guys come with me, right, and the senior citizen women, and they looked at us like we was meat, and hey, y'all come on and give us a hug. And I was like, what? I had to kind of tell them in advance, listen here now, this is what, and no, seriously, you can see it in the eyes. Wasn't no shame to say it. They say after you get a certain age, you say what you want to say. and they was just saying it, and it just makes you think. This coming out of this person, imagine how they are just amongst themselves, you know, and so
yeah.
it's a lot. And like Mark was saying, you know, Peterson was saying, you know, with the blue pill and everything, what they said the blue pill lasts for like 4 hours or something.
Well, you don't want to last 4 hours, but you can up to that. But if you get to a 4-hour erection, you need to get to the ER, because if they don't fix it, guess what? You're gonna be permanently impotent.
Wait a minute. Say that again, please.
So yeah, the 4 hours is the limit, is what it should be. If you have an erection for 4 hours, brother, that is a problem. And if you don't get it fixed, you could potentially be impotent for the rest of your life. So if you have an erection and you feel like it's getting to that point where it's still not going down, you need to get to the emergency room. And unfortunately, they're going to have to stick a needle in your penis to drain the blood off so that it will go down. But if it lasts longer than that, you could actually lose your ability to obtain an erection moving forward.
Who you think gonna go to the emergency room when they can't?
You trust me, bro. It hurts. If you've ever seen.
No. Who's gonna go? I'm laughing as hard, but who's gonna go to the emergency room erected? They can't go down.
Trust me, brother. It happens. Trust me on that. Trust me when I tell you, it happens because it hurts. Your penis will start to swell, and it will start to turn color, and it becomes very, very painful because the blood is trapped and engorged in the penis. And the only way to get it down is to put a needle in the base of the penis and draw it out.
Man, I pray to God never eat that pill.
Brother,
well, but it doesn't happen to everyone. See, what some of these guys don't tell you though, some of these guys are lacing the Viagra with something else.
Yeah.
They're taking the Viagra, then they might be taking some Mollies, they may be snorting a line, they may be smoking a joint with something laced with something else that interacts with what they're doing, or they may be taking some other prescription medications that they haven't told their doctor about that are interacting with the Viagra, causing this to happen. That's why you have to be transparent when you're getting this. But sadly, you can cop Viagra on the streets for about $15, $20 a pill anywhere in the United States right now.
Yeah, I remember years ago when I was working a part-time job, I had this young guy, probably in his 20s.
Mm-hmm.
I worked with a guy who was in his 60s that had Viagra. This young man asked the older gentleman, "Could I get one of your Viagra pills?"
Yeah.
And I said to him, "Whoa, bro, what are you trying to do to yourself?" He said, "I got a hot date. I want to put an impression on."
Yeah, he want to put it down.
And I said, and the older gentleman said, "Look, man, you don't want to do that, because once you start doing that, she's going to expect it every single time.
All right.
And then when you can't deliver it, that's when I come in."
That's what Jody come in. Exactly. And another thing I'll add, brother, is before they started regulating this, some of the guys were doctor shopping. They would go to several doctors across the city and get the prescription, and they were using it to supplement their income. And they were known as the Viagra pill pushers in the hood. And you could go get them, and Pops always had what you needed. So yeah.
I mean, so they went and got the pills and they went and sold them.
Yeah, they were. So before we regulated it, they would go and get like 4 or 5 prescriptions. You could get about 2, 5, 4, or 6 pills at a time. Think about it. If I got 4 pills and I got 4 prescriptions, that's 16 pills. If I'm selling them for $20 a pop, that's a nice come up. And if Medicare,
but you're not supposed to, they're not supposed to give you all your refills at the same time.
No, you're going to different. This is before we regulated it. It's different now. But before, when it first hit the market, guys would doctor shop. They would go to a doctor on the north side, then go to a doctor on the south side, and vice versa. And then they would go to different pharmacies before the pharmacies all became connected. They would go to Walgreens over here, go to MediShop over here, CVS over here, and Walmart over there. That's before they got connected. Now the systems are connected, so you can't do it. But prior to that, oh, bro, it was a main hustle. It was a hustle out there in the streets with Viagra.
Yeah, they connected like the banks are now.
Yes, indeed. Yeah. Yes, indeed.
Yeah, like, I mean, so Viagra was like Percocet and all that stuff out there in the streets.
Oh, yeah, they were making syrup and all that with the Percs and the Somas and the hydrocodone and the promethazine. Trust me, I've seen it all, brother.
Well, maybe we don't need to go to number 5, because maybe that's why number 5. Okay, so the word number 5 is stress.
Well, stress is stress is necessary. I'll put it like this. Stress is necessary. It is a necessary part of life, but it can, if you have too much of it and you don't manage it well, it can cause you to, it can shorten your life. So, but stress helps us perform when we need to perform. Stress helps us step in and protect when we need to protect. But also constant stress can affect your hormones in your body, lead to weight gain, lead to your male hormones not working properly, also lead to diabetes affecting you, and it can affect your sleep and love life. So you got to balance it. But stress, unfortunately, as a Black man in this country, we got stress just being that. On top of, depending on what you do professionally, where you live, and the people you associate with, just add additional stress. Well, you just got to find a way to balance it, brother. And
I'll tell you,
life.
yeah, as a Black man, because you look in the mirror before you go out the door, you say, I'm Black again. And,
Yeah.
And you got to go out there Black. You know?
Yes, sir.
And everything you about to do today is Black. And then you tense about how am I being seen Black, how I'm going to be treated Black, and that was because I'm Black, and that, yeah. And we got to get to a place, with that so that we will not be stressing ourselves out. But like you said, almost like there's good fat and bad fat, there's, good stress and bad stress. You got to know when it's not working for your good, but it's working against you. Yes, because sir. there's some that pushes you, right, to excel greater and do better. And then there's some that makes you, that knocks you down and makes you feel drained. And so you got to be able to differentiate the difference.
Yes, sir.
Yeah. Man, this has been good. Mark, is there anything before you leave that you wanted to ask him, that you wanted to say, man? Peterson. Anything.
Sorry about that. I had my mic muted.
Right.
Brother has covered a lot of topics. Very informative. We, like you said earlier, we have to go see our doctors regularly. Do our checkups. Don't be afraid. We don't like going to funerals, but we can prevent it. Death is inevitable. We understand that, but let's make the longest time period we have. Let's go to the doctor, get checked out.
I agree, brother. I agree.
Yeah, because the word of God, this is what the word of God has for us, that we prosper and be in good health. This is what God has for us, even as our soul prosper. But one thing too, we talk about death, but you don't want to be walking around looking dead. The Walking Dead.
That's a good one, brother. That's a good one.
There's some people that look like, oh man,
like what have they been through?
Yeah. They look like everything they've been through, and what you've been through, they look like it.
Dead warmed over.
Right, and so we definitely want to make sure. So as we're gonna move forward with our next one, talking about wellness and stuff, just how to better care for ourselves, and everything. So I want you to put that in your mind as we go into the next time we bring you on, just looking at what are some things, because I know one of my hows is a Mediterranean diet, and I know that there are a couple of other things that, and so the different things that we hear, there's myths out there, there are different things, everybody got a program and stuff, and so it's just good to be able to hear from you when you come back about some of these wellness things that we need to embark upon, so that if we're not getting it nowhere else, I pray to God that this platform and anyone who sees it, that they will send it to someone, and that they would take something from it, because transformation comes from communication, through communication.
Amen.
And that's what we are trying to do tonight. And I tell you, man, your voice has been valued, and your voice, and the wisdom that comes out of it. So we appreciate you. Are there any closing words, salutations that you want to give to the audience?
Yeah, I would, again, Brother Gidron, Brother Peterson, Brother Leon, and the Black Brothers View Network. I want to thank you all again for this opportunity to be on your platform and speak to your audience and share this message here tonight. I love what you brothers are doing. Again, I appreciate the invite, and I look forward to our next opportunity chopping it up and talking about whatever, brother. Because again, I'm an open book. I have nothing to hide. And if I can give it to you, brother, I'm gonna give it to you raw and real at times because I want you to get the message. But at the end of the day, I want you to remember that you need to focus on preventive health and be proactive about your health and not wait until something happens to try to get that check. Because from a Priority Mail standpoint, it's easier to stay well than it is to get well. Hashtag Priority Mail. I want you to think about that. Think about it. It's easier to stay well than it
Yes.
is to get well. Hashtag
Yes.
Priority Mail. And I know some guys that have a lot of resources, but their health is gone. And no one knows what your price for paying for your health is from me. But at the end of the day, I know guys that will give up everything they have to buy back their health if they could. And I sadly see men work 20, 30 years on a job, neglect their health. They amass a $2 million retirement policy. And guess what they end up doing when they retire? Their new job now becomes going to this doctor, going to that doctor, going to this specialist, going to that specialist, paying this copay, paying that copay. And before you know it, you have surrendered that $2 million back to the healthcare system, and you have not enjoyed the golden years of your life. So it is what it is, brothers. But follow me if you are, brothers, if you are interested, you can join the Priority Mail group, and that's PRYORITYMALE. You Google Priority Mail. I'm on Instagram, Facebook, Twitter, and YouTube. I have a website, which is PriorityMailLLC.com. Brother Peterson shared that earlier. I appreciate the plug. But brothers, I welcome you to join the Priority Mail group. It's a private group with men's only. It is our safe space where we talk about all men's health stuff. And again, brother, he can speak to it. And it's raw and real, and it's on a level where men can understand, tried, true, and transparent. And hopefully it resonates with you. Because again, my goal here is to help motivate you, educate you, help you navigate your wellness journey, and leave this place better than I found it. And I don't know anybody out here in these Facebook, Instagram, or Twitter streets that's doing what I'm doing, brothers.
Amen.
No, man, I mean, for free. And like I said, one of the things I wanted to say earlier, you need to be honest when you go to your doctors. Be honest with them, because they can best cater to you if you're honest with them. You don't, don't feel shame when you're talking to your doctor about you, So I love the way that you share and that people can come in, and just the way that God has allowed you to be able to relate to everyone. It's a platform. So whatever it is, and when I say, as you said, you talk about everything from A to Z, but it's all done tasteful, it's done professionally, it's done like you're talking to your brother or your best friend. And that's important, And so, like I said, once again, appreciate you. But as you were speaking, we lost two musical legends who had a lot of wealth. I was thinking about Michael Jackson and Prince as you were speaking, and they had health concerns, health issues or whatever, and
think about John Singleton.
Yes, man, that's my boy, right? Young,
Stroke.
all of them young, right? And even with Tommy on
Tommy from Martin,
right? And so, and what I'm saying is that they had celebrity, they had money, but they had health concerns. I don't know where they were with, staying on top of that.
Same place we are, brother. Same place we are.
Yeah, all I know is to what you said is that you can have the wealth, all the stuff you gain, and if you didn't take care of your health along the process and stayed on top of that, or value your health as greater or as much as you value gaining money,
all right,
then what is it going to gain you, So nevertheless, we're going to have you back. I appreciate you. I just say to everybody, take care of yourself, brothers out there. We love you much. Those who come back and watch it later, if you have any questions, make sure and put it in there. My son, Shabbat, one of our technicians, he has dropped a album, Summer Vibe, and so we're gonna put that in the lineup with the videos on the page as well. Mark, we can do that on YouTube. And so check him out. And he was dealing with something with a strep throat. He was Googling it and taking pictures and all kinds of stuff. And some same thing you were saying just yesterday. But I'm glad that he went on and he followed up. And so a doctor did a telecommunication with him.
Telehealth visit with him. Yeah.
Telehealth visit, right. And it was like, yeah, that's your basic case of that, you know. And so got on top of it, you know. So I just thank God for all that you all are doing out there in the medical field. Take care of yourselves while you're out there on the forefront. We love you all so much. And I say to everyone in closing, I wish that you prosper, be in good health, and above all, prosper, be in good health, even as your soul shall prosper. This is DL Gitron, your producer, Mark Peterson, co-host today, Leon DeBerry, our guest today, none other than Eric Taylor, wishing you well. God bless you. Peace. Take care.
All right, brothers. 06. Appreciate y'all, man.
06. Thank you, man.